Hello everyone and welcome to Constipation 101. This is a mini course all about constipation in kids. So if your kiddo is struggling with this, then check out the rest of these videos and hopefully this will be helpful for you. So I'm going to give you a brief rundown of the topics that we're going to cover in this mini course. So we're going to start off with what is constipation, how is it diagnosed, and what causes constipation. Then we're going to be talking about fiber, water, picky eating and constipation and the link between those things. We're going to talk about how sensory needs affect constipation. We're going to quickly touch on food allergies and constipation. We'll discuss constipation and potty training, and then finally we'll talk about constipation fruits, and then we will do a Q&A. So first, this video is about constipation in children and babies ages 6 months and up. Constipation in infants who have not yet started solids is a whole separate topic, and we're not going to get into that here. So let's first talk about what can cause constipation. So there are a number of causes, including anatomic malformations in the GI tract or spinal cords, metabolic conditions like hypothyroidism or diabetes, low muscle tone, other gastrointestinal disorders including Hirschsprung's disease, systemic disorders like celiac disease, inflammatory bowel disease, cystic fibrosis, food protein-induced allergic proctocolitis. Some psychiatric disorders are linked to constipation. And then there's also idiopathic constipation, which is when there's no known cause. So constipation even has a genetic component. Now, okay, those are all the causes of constipation. And now we're going to talk about how do you know if your kid is constipated, which if you're watching this, your kid is probably constipated, or how is constipation diagnosed? Because chronic functional constipation is something that a medical doctor will diagnose some kids with. Constipation is related to nutrition, but it can also have no nutrition causes. So diet does not cause all constipation. Say louder. Diet does not cause all constipation. So therefore, it cannot cure all constipation. Sometimes medication is needed for constipation in kids. And that's why it's really important to keep your pediatric dietitian and your pediatrician in the loop if your kid is experiencing frequent constipation. So if a child has constipation, but it's not explained by another medical condition, then we call it functional constipation. So for a kiddo to be diagnosed with functional constipation, they must meet the Rome-4 criteria for functional constipation. So I'm going to throw up an image here if you're watching it on YouTube. Here is the criteria, but I'm also going to go through it with you too, especially if you're listening on podcast. So the Rome-4 criteria specifies that 2 or more of these criteria that I'm going to list need to be met at least once per week for at least 1 month. And their symptoms can't be explained by another medical condition like the ones I talked about previously. So I'm going to go through those criteria right now. So first is 2 or fewer defecations in the toilet per week in a child of a developmental age of at least 4 years. So meaning they're old enough to be potty trained and they're pooping 2 or less times per week. They have at least 1 episode of fecal incontinence per week, meaning they poop their pants at least once per week. A history of retentive posturing or excessive volitional stool retention. So they're holding their poop in. A history of painful or hard bowel movements, which usually we can tell by straining or crying or a kid just verbalizing that it hurts. A presence of a large fecal mass in the rectum. So this, you can identify this with imaging. A history of large diameter stools that can obstruct the toilet. So your kid's clogging the toilet a lot. So those are the Rome-4 criteria. And remember, your child needs to meet 2 of those happening once per week for at least once per month for them to be officially diagnosed with constipation. But even if your child doesn't meet these criteria and is uncomfortable or showing symptoms of constipation, that still matters. And clinical nutrition approaches would generally be the same. So if your child is uncomfortable, something needs to be done, even if they're not technically diagnosed with constipation. But if your child has a medical condition that can cause constipation, the nutrition approach may be different than if your child is diagnosed with chronic functional constipation with no other known medical causes. So just keep that in mind. In this video, we're going to be chatting about nutrition approaches for functional constipation in kids or constipation with no other known causes. So we're going to talk about fiber next, but since part of the diagnostic criteria for constipation includes the frequency of bowel movements, I want to answer the question, how often should my kid poop? Because I think a lot of parents want a number. And so part of the constipation diagnostic criteria is less than 3 bowel movements per week is problematic. So for an otherwise healthy child, we expect them to be pooping every other day-ish. What is normal, however, varies depending on the child. Many kids poop every day, some even more than once per day. We can't just look at the number of times your child poops per day and say, yep, that's good. So it's also important to look at consistency of the poop and comfort. Are they straining? Are they having accidents? Do they have a big uncomfortable belly really frequently? So if your child poops approximately every other day and doesn't strain or regularly have tummy aches, then that's a healthy poop schedule. If your child is constipated, has frequent tummy aches, or is straining a lot when they poop, it's time to chat with your child's pediatrician.